Hi everybody, I'm Dr. Lisa Erickson, and today we're going to discuss taping your pulleys, and I want to compare H-taping versus the Swiss style of taping, which is just a circular tape job as I have here. The difference between H-taping and just the circular tape job is it unweights at a different area. So taping around the pulley in question, so this would be a tape job for the E22 pulley, the pressure on this from the underside is what's unweighting that pulley so that it lasts longer. Research shows that this helps. However, with the H-tape job, research shows that it will actually provide more stability and give you more force as you're pulling. So the H-tape job, you actually get more power out of it. But with my average athlete that does both of them, this one really feels like it unweights an injured pulley, whereas the other tape job just gives more structural stability to that whole region. So let's discuss exactly how to tape for an H-tape job. So just taking your basic climber's tape, let's go ahead and tear it at about, depending upon your finger size, we want to tape it long enough that you can wrap it around at least one, maybe 1.5 times. So tearing the tape from either side, we're going to go in and we want to leave about 1 centimeter of the tape that's actually still intact. Doesn't have to be perfect. The whole goal is just to spread the weight of that of the tendons against the pulley over a larger area. So taking the center knuckle, let's go ahead and take this tape job off. Let's pick a different finger. Taking the center knuckle of your joint, so this is your dip and this is your pip, proximal interphalangeal joint, and this is your dip, distal interphalangeal joint. So taking your pip, we're going to take the tape and we're going to center the center of the H right underneath this joint. So going underneath it into this crease, that's where you want to put the center of the tape. So let's go ahead and do that. So it ends up looking like so. And then as we wrap one piece around one side of the joint and the other piece around the other side of the joint, that tape should be centered with the center of the tape underneath the joint and on both sides. Yes, this one does happen to be near your A2 pulley, and yes, this one does happen to be near your A4 pulley, but that's not the goal of this tape job. The goal of this tape job is to take the whole tendon and hold it against the bone, and this spot particularly is where that tendon has the most gap or the most space away from the actual structures of your bone when you're climbing. So research shows that if we press in this area with our H-tape job, we're going to have more stability throughout the whole area. So that is the difference. So here is our H-tape job, and then here is our basic, we call it the Swiss method of taping. That's the only difference. So with someone that has an injury on our E2 pulley, this would be a perfect tape job for it. If you've injured your first cruciform pulley, cruciform is cross stitch, and the pulley is just on this side of the joint, attaches close to it, but distally to your E2 pulley. So this tape job would be better if we have a cruciform injury in itself, or if we're trying to unweight further down the finger, so into A4 or any of the other pulleys. This one unweights it overall through the full finger, and research shows you get a little bit more force with having that tape job. This one I've noticed in office my patients seem to be happier with. It compresses, it gets the swelling out of there, and Schoeffel has shown that he wants you to tape this way for 3 months after just a basic sprain. If you've actually ruptured that pulley, maybe up to a full year of keeping it taped after an injury. So that's just a little breakdown on pulley taping. I hope you enjoyed it and have a great day.